That Sandilands Rehabilitation Center has seen more and more patients in recent years. This according to health officials who believe that with more community support, these numbers can be drastically reduced. Our Noel Ferguson spoke with officials of the facility and filed this report.
The demand for mental health care services in the country has increased in recent times, and this has kept employees busy at the Sandilands Rehabilitation Center, and beds at that facility are filled on a daily basis. According to Chief Psychiatrist Dr. Nelson Clark, more support is however needed for persons who suffer from mental illness in our society.
In order for people to live who have chronic mental health problems, they require quite a degree of support in the community, clinical support, as well as things like housing, etc., employment.
Hospital administrator here at the Sandilands Rehabilitation Center, Sharon Williams, says that of the 400-plus beds that make up the facility, about 100 of those are dedicated to geriatric patients, whereas the remainder is dedicated to psychiatric patients. She said sometimes they do see repeat patients.
We have substance abuse as well as acute and chronic psychiatric treatment.
And on a regular, you're always full.
On a regular day, we're always full within our services.
A significant number of our admissions are repeat admissions, and these are often people who have chronic mental health problems. Admittedly, when they're discharged from hospital, they're reasonably well, but compliance with medication is often an issue. People's lack of willingness to follow through with treatment recommendations is also a significant factor.
Dr. Clark says for years there has been a stigma attached to Bahamians seeking mental health care. While he believes the stigma still exists, Dr. Clark says it's slowly changing. He noted that the financial state of the country has also had an impact on the mental stability of many Bahamians. This further adds to the demands at Sandilands.
The economic downturn has had an effect on people's mental well-being. The kinds of illnesses that result from that are, of course, the common things like depression and stress-related illnesses. People are ashamed, people know that there will be talk about them, people know the ways in which the community look at people who suffer from mental health problems. So the stigma does affect people's willingness to accept and to continue with treatment.
Now, the Ministry of Health is looking to offer mental health services at various community clinics around the Family Islands and right here in New Providence. This will hopefully lessen the strain at the Sandilands Rehabilitation Center. Noel Ferguson, ZNS Network News.